Governor Garu, E.S.L.Narasimhan Garu, C.D. Ara Garu, Srinibabu Garu, Anmol Garu, distinguished guests and invitees, press and electronic media, delegates, ladies and gentlemen. It gives me great pleasure to participate in the second edition of the Indo-Global Health Summit and Expo 2015 on innovations and advances. I am thankful to Indus Foundation for giving this an opportunity to associate in organizing the Mega Indo-Global Health Summit 2015. Friends, as we are all aware that the healthcare has become one of the India's largest important sector, both in terms of revenue and employment. There are various opportunities and innovations in healthcare infrastructure, both in urban and rural India, requires roughly 7 lakh additional beds over the next 5 years. Only 3% of the specialist physicians cater to the rural demand. Though the sector is growing spare, it's facing many challenges. One of the most key challenges is shortage of qualified medical professionals. There is an acute shortage of paramedical and administrative professionals. Many patients, especially those living in rural and semi-urban areas, are still receiving services from the unqualified practitioners. The industry needs an additional 1.5 million doctors and 2.4 million nurses to match the global average. Also, India's healthcare center is a capital incentive with a long gestation and payback period for new projects. Land infrastructure costs account to 60 to 70% of the total expenditure of the hospital. I feel that one way to increase India's healthcare funding and access, though innovative public-private partnerships, while I appreciate the model of partnerships at a primary, secondary and tertiary levels, still remains a distant dream. Participation by the government and the private sector will help create a blueprint for such partnership to create an infrastructure for the future. One more important issue I would like to bring to your notice: the deterioration in the quality of healthcare providers need to be addressed immediately by strengthening the supervision, establishing quality standards in teaching, designing new course of cope with the rapidly changing disease. Telemedicine is a fast emerging sector in India. India also offers vast opportunities in R&D as well as medical tourism. The challenge for Indian policymakers is to find ways to improve upon the existing situations in the health sector and to make equitable, affordable and quality healthcare accessible to the population, especially the poor and the vulnerable section of the society. The summit slated to focus on the latest trends and developments in the Indian and international healthcare industry that will address all critical challenges, opportunities and latest issues by the participating healthcare fraternity. I would like to assure from the chamber side, we will like to focus on the development and will definitely coordinate with the fraternity and from the government side. I would like to congratulate all the award winners for their recognition and hope that they will continue to serve the cause for the country in the future in all dimensions. I once again thank Indus Foundation for giving this opportunity to share my thoughts. Thank you. Thank you very much.